Well, good evening. Good evening, everyone. We're about to begin our webinar entitled The 7 Ways to Decrease Risk of Breast Cancer and Live a Healthy Life. My name is Clarence Parks, and I've teamed up with the Sisters Network, Prince George's County, to help save lives by providing information about breast cancer in the African American community in general and Prince George's County, Maryland in particular. Now, this is very important because according to the Susan Komen Community Profile Report, National Capital Area 2010, Prince George's County, which is where I live, has a 30.2% mortality rate amongst African American women. And that is unacceptable. That is unacceptable because that is one of the highest rates of mortality in the United States of America. However, according to the American Cancer Society, there are strategies that may help to prevent breast cancer to include avoiding weight gain and obesity, engaging in regular physical activity, and minimizing alcohol intake. The most obvious strategy is clearly early detection by mammography. The American Cancer Society also says early detection of breast cancer by mammography also leads to a greater detection of treatment options, including less aggressive surgery. However, unfortunately, many of our sisters procrastinate in taking these very simple steps. And that is why tonight it is my distinct honor to introduce our guest presenter. Our guest presenter is Priscilla Q Williams, who is a registered nurse who specializes in oncology and is a certified chemotherapy administration nurse. This sister is bad. I tell you, she is there on the spot, and she is helping people in, I'd say, one of the most critical times of need. She is also a medical ambassador for the American Cancer Society and sits on the board for the American Diabetes Executive Council and Community Outreach for African American Initiatives. Nurse Priscilla has been featured on television and radio where she has educated people about women's health care, including diabetes and cancer prevention. She has spoken at large-scale women's conferences, and she writes for a national health magazine, Girlfriend's Health Guide, and has helped to treat hundreds of breast cancer patients. Priscilla is the host of the Priscilla Williams Show, a Christian radio show which focuses on health, wellness, and women's empowerment, and she is the author of an ebook entitled Living a Life of Passion and Purpose, What on Earth Are You Put Here For? Now, she also has a new ebook entitled Learning to Live a Healthy, Happy Life, and that was released in April 2013. I like her mission. Nurse Priscilla's mission is that her overall mission is serving others through education and empowerment, and she wants to be an inspiration to others to live a healthy, holistic life. Her motto is to live a powerful life, a life of passion, a life of purpose, and ultimate health. Tonight, she will present the 7 ways to decrease the risk of breast cancer and live a healthy life. So, without further ado, it is my distinct pleasure to introduce Priscilla Q Williams, author, speaker, health and wellness coach, and nurse consultant. So with that being said, Nurse Priscilla, welcome, and we are looking forward to your presentation.
Thank you so much for having me, Pastor Parks. That was a great introduction. Thank you so much.
It's my pleasure. So I would say just take it away. I'm going to release the controls of the PowerPoint. In fact, I'm going to take the webcam off of myself, and it's just going to be you presenting. If I have any more questions, I'll be able to interject them by way of audio. I don't need to be seen. I just want to hear what you have to say. So as they say, take it away.
Okay, thank you. Well, first again, I would like to thank Pastor Parks for having me as a guest tonight on his powerful webinar. And we're going to talk about 7 ways to decrease our risk of breast cancer and to live a healthy life. So we're going to go ahead and get started. First slide we're going to start off with is talking about what does it mean to be healthy. So this slide is, most people think to live a healthy life is to avoid one illness or another. They may think it's to go without medications or to go without medical treatment. But really being healthy is being physically well, being mentally well, and being spiritually well. We have to have all of these aspects in our lives in line in order to really live a healthy life. It is a way of living that allows you to enjoy more aspects of your life in a more fulfilling way. It's not about, again, trying to avoid an illness or avoid taking medications. But to really live a healthy life, we must, again, be well physically, mentally, and spiritually. So we're going to dig in tonight a little deep, and we're going to talk about 7 essential ways to live a healthy life. And I'm going to go through those 7 ways, and then I'll go into depth. So number 1, of course, is exercise. That's the first way to start off by living a healthy life. And we'll go more into depth into each one of these. Number 2, eating healthy. You'll find out millions of ways about how eating healthy can avoid illnesses and sicknesses, avoid medications. Number 3, reduce stress. And this is a big one, that a lot of people are under stress, and stress does kill you. So definitely we're going to talk more about that. Number 4, to limit our alcohol consumption. Now this here goes more into avoiding our risk factors for breast cancer, and I'll talk more about that, and I'll even give some statistics. Number 5, know your family history. Number 6, annual exams, making sure we get those annual breast exams. And then number 7, consider genetic testing. All of these things are important. There are much more ways that we can avoid breast cancer, health disparities, but here are a few key 7 that I wanted to give you. So let's look at the benefits of exercise. Exercise does a couple of things. Number 1, exercise controls our weight. Did you know that exercise can not only prevent weight gain, it also can help you maintain weight loss, and then it also burns calories when you're physically active. The more intense the activity, the more calories you burn. You don't need to set aside large chunks of time to exercise to reap weight loss benefits. So I always tell my patients, if you can't afford to go to a gym, you can always park at the back of the Walmart and walk up to the door. You can always walk around your neighborhood. There are plenty of things you can do when you clean your house, when you vacuum, when you mop. These are just different things we can do to keep ourselves active. So we should be doing at least 30 minutes of exercise 3 times a week or more. The more, the better, of course. Exercise also decrease your risk for health conditions and diseases. So if you're worried about heart disease, breast cancer, exercise decrease those risks. Again, exercise decrease those risks. If you want to decrease your risk of high blood pressure, of course, the high cholesterol, a lot of African Americans battle high cholesterol. So we want to make sure we're active and we make sure we're moving to decrease those risks. In fact, regular physical activity can help you prevent and manage a wide range of health problems and concerns, including stroke, metabolic syndrome, type 2 diabetes, depression, cancer, arthritis, as well as falls. So when you move and you exercise, you even decrease your chances of becoming depressed. People don't realize that exercise decreases stress. It really does. Exercise improves mood, and, again, release stress. So if you work out at a gym or a brisk walk, 30 minutes, this can help you. This stimulates various brain chemicals that may leave you feeling happier and more relaxed. So have you ever exercised and after you're done, you feel great, you feel like you can conquer the world? What happens is your body releases a chemical called endorphins. Those endorphins are that feel-good hormone that makes you feel great. So you can think clearly, you're in a better mood, you're not as cranky. So exercise has a wealth of benefits. It also boosts your confidence and your self-esteem. Many studies show that if you exercise before you go to school or before you go to work, you actually can think clearer. You actually can do better on a test, or you can have better performance at work. So we're going to move to the next slide. The benefits of eating healthy. So now you may hear a lot of people talk about eating clean, eating healthy. Eating healthy really does have the benefits. So I have 3 key points here. Eating healthy, of course, it controls your weight. You can lose as much as 20 pounds after several weeks of good, healthy dieting. If you eat a healthy diet, you can lose weight automatically, even if you didn't put exercise with it, just from eating healthy. Eating healthy is also your all-in-one pharmacy on a plate. So you can decrease those medications, those high blood pressure medications, those diabetes medications, as well as those high cholesterol medications. You can go without taking any medication if you change the way you eat. Eating healthy can effectively fight and prevent disease. It is a known fact that most diseases today are caused by an unhealthy diet, whether it's because of the quantity of the fat and calories, which leads to obesity, the lack of nutrients, need for a strong and healthy immune system, or the amount of chemicals and trans fats that are included in processed foods. Unhealthy eating can lead to a major health problem such as diabetes, heart disease, and, of course, cancer. So, of course, you want to stay away from those processed foods. That's those foods that are like TV dinners, those canned vegetables in the can. You should always go for fresh vegetables. If you can't get fresh vegetables, you can always do frozen. Frozen is always better than buying vegetables in a can. So you always want to go for foods that are fresh first, and then if you can't get to fresh, you can always go for those frozen vegetables and vegetables that are with color, green, yellow. You always want to mix it up. So you don't want to just keep the greens and cabbage. Try some other things like kale and char. You want to try some things and mix up your vegetables. Healthy eating can increase your energy level. Did you know when you eat healthy, you have more energy? Did you know when you eat a burger and fries and McDonald's, you actually feel sluggish and you feel tired? And the reason is because your blood sugar level shoots up. So when you eat an unhealthy diet, you automatically feel tired and sluggish because that grease and the fat, it always slows you down. But when you eat a salad and you eat fruit and eat a vegetable, you always have more energy. You can become more productive and socially. And so we always want to have those whole foods. Again, staying away from those processed foods. So anything that can sit in a can, anything, the macaroni and cheeses in the box, make your own fresh macaroni and cheese, homemade, things like that. You always want to go for those things that are homemade, that you are adding those ingredients, not things full of salt and sodium. You want to stay away from those. Now we're going to go to our next slide, number 3. Now this is a big one, why you should reduce stress. So some key points here is to reduce stress lowers your heart rate, it lowers your blood pressure, it slows your breathing rate, it increases your blood flow to major organs, it reduces muscle tension and chronic pain, it improves concentration, it reduces anger and frustration, and to get the most benefit, use relaxation techniques along with other positive coping methods, such as exercising, getting enough sleep, reaching out to supportive family and friends for assistance. I've seen so many patients end up in the ER. I did ER nursing for quite a few years before becoming an oncology nurse. And so many people would come in on a Monday, believe it or not, when they start back to work, heart attack symptoms, chest pain, strokes. They're stressed out about work, the kids, family, relationships, or what have you. Stress literally kills you. It increases your risk for cancer, diabetes, heart disease, and everything. So we definitely want to decrease our stress. And of course, moving, again, exercise, that decreases our stress. Eating a healthy diet decreases our stress. And then learning to take away those things that are stressors for our lives, whether it's people or things. We have to take care of ourselves before we can take care of anybody else. So we're going to go to number 4. Now, in these slides, this is more geared toward decreasing our risk for breast cancer. So we want to limit our alcohol consumption. But before I go into that slide, I want to share these statistics with you. 1 in 8 women are diagnosed with breast cancer, and white women are more likely to develop breast cancer than African American women. However, women 45 and under, breast cancer is more common in African American women. So the younger ladies who are diagnosed with breast cancer are actually African American descent. And black women are 2 times more likely to develop a more aggressive form of the disease with fewer treatment options. And I'll tell you why in a minute. The American Cancer Society reports that breast cancer kills black women at a 41% higher rate than any other race of women. I'm going to say that again, that 41% of African American women die at a higher rate, at 41% more than any other race. That is amazing that this happens day after day. I've seen so many women lose their lives, and we'll talk about that. As Pastor Parks mentioned, procrastination. And I'll tell you a few reasons why this is happening. But let's go into this next slide of limiting our alcohol consumption. So these slides are geared toward decreasing our risk of breast cancer. Research has shown that 2 drinks a day could increase breast cancer risk by 21%, according to the National Cancer Center. So when you drink more than 2 drinks in one day, this actually increases your risk by 21%. The more alcohol you drink, the greater your risk of developing breast cancer. If you choose to drink alcohol, including beer, wine, or liquor, you need to limit this to no more than 1 drink. Of course, smoking. Smoking is bad, bad business. Smoking, of course, it says it on the pack that definitely can cause lung cancer. But not only that, smoking causes vasoconstriction, where it constricts all of your vessels in your blood. So the blood has a harder time getting through, and it also releases hormones, the tobacco. So it's just bad business. You're at risk for any type of cancer when you smoke. Alcohol also breaks down a substance called acetaldehyde, which can cause genetic mutation. So this is a permanent change in the DNA sequence that makes up your genes. So all cancer is growing of cells that grow out of control. So when the more alcohol you drink, the more this hormone is released. The more this hormone is released, the DNA sequence changes. So now you have this growth of cells that's just going to continue to grow, and that's exactly what cancer is. So we have to be really mindful when we drink and when we smoke. Those things, bad business. Leave alone. So definitely, if you don't remember anything else, remember that alcohol and cigarettes definitely increase your risk for cancer. Number 5, know your family history. In about 15% of breast cancer cases, there is a family history of the disease. According to studies, if you have 1 first-degree relative who had breast cancer, your lifetime risk doubles. And if you have 2 or more family members, so that could be a mom, a dad, brother, sister, then your risk increased 5-fold. Most women with breast cancer do not have a family history of the disease. Only 13% of women diagnosed have an immediate female relative, that's a mother, a sister, or a daughter, with breast cancer. When talking about family history, it's important to consider the men in your family. So a history of breast cancer is in a close male relative, so that can be a father, brother, or uncle, can increase your risk for breast cancer. Now, with that, a lot of people think if their dad had, let's say prostate cancer, or an uncle had lung cancer, that doesn't necessarily count as a risk factor. That is a risk factor. There are plenty of studies that show that whether you're female or male, you still have a family history, and you have to let your physician know that. So that could be a father, brother, uncle, anyone in your family, male or female. You want to let them know you have a family history. Also, men do get breast cancer. In my career, I've only treated one man with breast cancer, but the numbers are much less. But men still get breast cancer, so men, we have to be conscious as well to make sure if we notice any type of change in our breast area. Number 6. So this slide talks about the annual exams. Now, they did so many changes and studies, and so right now, you still should get an annual breast exam, mammogram, every year for women 40 and over. That has not changed. But just so you know, clinical breast exams at least every 3 years, and an annual exam and mammogram starting over 40. Now, if you have a family history, again, goes back to the mom, sister, daughter, you want to get checked sooner. So let's say you're 35 years old, but you had a mom that maybe died of breast cancer, a sister who maybe had breast cancer, or, let's say an aunt or something. You want to make sure you let your physician know that, because you may need to get a mammogram sooner than rather wait till you're 40. This is very important. If you have a family history, you want to make sure that you let your physician know, because you don't want to wait till 40 to get a mammogram. You want to get that mammogram sooner. Women with a family history should begin prior screening 10 years prior to that family member's age of diagnosis. So if you had a mom that was diagnosed at 40 with breast cancer, you want to start getting your mammograms done at 30, 10 years prior to that age, because you want to decrease your risk. Any slight change, they want to be able to catch that. You don't want to wait. The sooner the better. Early detection is always key. It allows adjustment and contrast to the image that can be easier to see, and young women at increased risk may also want to ask if either for MRI or sonogram in addition to the mammogram. Adult women of all ages are encouraged to perform self-breast exams at least once a month. So every woman should know how to do a self-breast exam. And that's when you're paying attention and actually using the pads of your finger to feel your breast tissue in a circular motion. You can do this in a warm shower or in the mirror while you're in the bathroom, laying across the bed. You just want to feel your breast tissue and make sure you don't feel any lumps at all, any type of slight change. And we'll go into those signs and symptoms of breast cancer. 40% of diagnosed breast cancers are detected by women who feel a lump. So establishing a regular breast self-exam is very important. I've treated many of women who discovered their own. It wasn't I remember treating this one young lady who's like 28 years old, who came in and discovered her own lump. But she noticed something different about her breast. She noticed that there was a mass there, and she went right away to let her physician know. So no matter what the age is, we should be teaching our young girls, teenagers, young women how to do self-breast exams. Very important. While mammograms can help you detect cancer before you can feel a lump, breast self-exams help you become familiar with how your breasts look, how they feel, so you can become alert and let your healthcare provider know. So we have to know our bodies better than anyone. Slight little change, we have to go to our physician. It doesn't mean every time if you feel a lump all lumps are cancerous. That's not true. But definitely you'd rather get it checked out because you'd rather be safe than sorry. Now, how should I perform a self-breast exam? Number one, in the shower. As I just described earlier, you want to use the pads of your fingers. You want to move around the entire breast in a circular pattern, moving from the outside to the center, checking the entire breast and the armpit area, checking both breasts each month, feeling for any lump, thickening, or hardening knots. Notice any changes and get lumps evaluated by your healthcare provider. You can do this in a mirror or laying down. And just so you know, some women notice changes in their breasts. They may feel a lump under their arm, and some women don't say a word. I know plenty of women who have one patient, I remember having a lump under her arm for about 6 or 7 months. She thought it was the deodorant she was wearing. She didn't mention it to anybody. The lump got harder and bigger. By the time she came to the physician, she came to us in stage 4 breast cancer. She was out of here in 3 months. So I just want you to know that whether it's a lump under your arm, on your breast, whatever, get it checked out. There's so many women who notice changes and don't say a word. They're afraid. They're afraid. So we have to open up our mouths and say something. Remember again, early detection is key. Number 7, consider genetic testing. Now, one of the tests that can be done to detect breast cancer is what they call BRCA testing. So breast cancer risk linked to family history may be due to shared factors. Families with a strong history may carry this gene mutation, and this is what the BRCA testing will detect. Some families have more than one immediate relative. So again, that mother, sister, daughter with breast cancer, you want to make sure that you get genetic testing. Family history of ovarian cancer may also be related to the inherited gene mutation. Inherited gene mutation account for only 5 to 10% of all breast cancer diagnosed in women in the United States. So when you see a younger woman who has cancer, most likely she has the BRCA mutation. So it's a simple blood test that can be done, and this blood test will let you know if you are a carrier of this BRCA gene. If you are a carrier, of course, if you had a family history, it just shows the chances of likely you're developing cancer. You may have seen in the media Miss Brad Pitt's wife, Angelina Jolie, who had both breasts removed because she was a carrier of this gene and she had a family history. So again, some women get this test done, and it can't hurt for you to get the testing done if you have a strong family history. Here are 2 red flags of being a BRCA carrier. It's usually Eastern European or Jewish descent, or having a family history of both breast and ovarian cancer. Or if you have either of these factors, see a genetic counselor or talk about getting tested. Inherited gene mutations account for only 5 to 10% again of all breast cancers diagnosed in women in the United States. So here are some signs and symptoms of breast cancer. The first thing, nipple tenderness or lump or thickening in or near the breast or underarm area. Again, it can be in the breast tissue or under the arm. A change in the skin texture or enlargement of pores in the skin of the breast. Some describe this as similar to an orange peel texture. So you know how the outside of an orange peel is. That's how the skin actually turns on the breast. And believe it or not, there has been women who have seen this, their skin turn, and have not gone to the doctor, haven't seek medical attention, and by the time they come to the oncology clinic, they're stage 4. And we don't have many treatment options. You have chemotherapies we can use or radiation, but your treatment options are much slimmer when you come with an aggressive form of cancer that have possibly spread through your lymph nodes or to other parts of your body. A lump in the breast It's important to remember that all lumps should be investigated by a healthcare professional, but not all lumps are cancerous, which I stated earlier. Other signs and symptoms: any unexplained change in the size or shape of the breast, dimpling anywhere on the breast, unexplained swelling of the breast, especially if it's one side only, unexplained shrinkage of the breast, if the breast draws up and gets smaller, a nipple that is turned slightly inward or inverted, skin of the breast or the areola, that's the dark part, or the nipple becomes scaly, red, or swollen, or may have ridges or pitting resembling the skin of an orange, as I said, the orange peel look. You want to make sure you call your doctor if you notice any of these symptoms. If it's something you're unsure of, you want to make sure to follow with your doctor. So here are some pictures, illustration of signs and symptoms of breast cancer. So you see here the first picture, a lump. You may notice just a lump in the breast tissue. The second one, skin dimpling. So if you notice where part of the breast is dimpling in. The next picture, changing in skin color or texture. So where, again, that orange peel look, if the skin becomes really scaly or red. Change in how the nipple looks, like pulling in the nipple. So if the nipple goes inverted. And clear or bloody fluid that leaks out of the nipple. So if you notice any leakage or anything like that, you know that's definitely a bad sign and you want to get that checked out. So we want to make sure that we take action now to live a healthy life. So these are, again, are summing up a few things that we can do. We want to regulate our portion size. We don't have to fill up our entire plate. We make sure that we have the right portion size. If we eat a piece of meat, it should be at the size of the palm of our hand. Again, we want to reduce our alcohol consumption. We want to reduce our caffeine consumption. So that's all of the soda pops, the sweet beverages. We want to stop smoking if you are. And we want to laugh a lot. Now, you may say, why did I put laugh a lot? But you want to laugh a lot because, again, when you have a happy, joyous disposition, spirit, actually, believe it or not, those people are healthier. Plenty of patients that I've treated in the oncology clinic, those people who have a positive outlook on their condition and on their life, they actually do much better than those who come in angry and bitter and mad. So believe it or not, people full of stress and anger and bitterness, that sets up illnesses automatically. Exercise at a moderate intensity for at least a half an hour 3 to 5 times per week. So that's 30 minutes, 3 to 5 times a week. Find ways to eliminate stress. Again, meditate, exercise, guided imagery, music. Give to others with no strings attached. The reason I put this on the slide is because when we give to people and we're free-spirited and giving and working with others, we actually feel good. Again, that's that feel-good hormone that I was telling you about. Smile at strangers. Learn to say no. Avoid people who put their stress on you. So, again, that stress is a big, big part. And then we want to take control of our life, take control of our health. Now, I wanted to also just share with you, you may be saying, well, why is breast cancer attacking African American women more so than any other race? Well, I wanted to share these statistics with you really fast. First, about 25% of black women in the United States live at or under the poverty line. And this can reduce their access to good health care and their lack of insurance. So if women don't have insurance or they can't find good health care, of course, they are not going to the doctor. Black women have a tendency to seek out breast treatment at a later stage, which I was sharing with you. They notice that lump. They notice drainage. I've seen it so often. People come in and they notice these things for months, but they were afraid. They didn't want to know the unknown of the word cancer. They ignore the problem, again, because of fear, or they may think it just Can't happen to me. Black women are also more is the lead of their household. They're more heads of the household, so they tend to put off treatment because they want to keep things running smoothly. So I've seen plenty of patients, African American women, come in and they delay their treatment by a month or 2 months because they can't afford to take off work. They're trying to take care of their children and pay bills, so they can't take off work. This may result into women getting to the doctor later, and then when this happens, that cancer can spread to other regions of the body, including the lymph nodes. So these are just some of the things that I wanted to share with you about why it affects black women at an even higher rate than any other race. So we really have to be proactive about our health and really know when we notice a lump, anything, we have to seek a physician, whether you're scared or not. God did not give us the spirit of fear, but he gave us the spirit of love, peace, and a sound mind. So we just have to know and trust that whatever the outcome is, that he's going to take care of us. I've seen so many women come in at stage 3 and 4, and those women are gone. Those women are gone. I have also seen women who come in at stages 1 and 2 and 3, and they are still around here today. So there is hope. You have to make sure that you be proactive about your health and seek a physician at the slightest little change, at breast or any change in your body, any change. So we can open up for questions. I'm going to pass it back to Pastor Park.
I am speechless, which for me, again, is fairly difficult to do. I usually have a whole lot to say about everything, but I'm spellbound by all of the statistics and all of the information that you've given. And the reason why I'm just kind of stuck in my tracks here is because it sounds like there's more than hope. There are some courses of action that we can take, which will prevent us from going as far down the road as breast cancer wants to take us. And, you know, I'm sorry?
I said yes, definitely.
Yes. And, you know, that is hopeful. I agree that God has not given us the spirit of fear, and that is something that we, you know, really have to address. I wanted to share something, if I could, and certainly not to in any way try to steal the spotlight from what you've just presented, because I would not be able to do that. That was one of the most excellent presentations and renditions of, you know, strategies that can be taken that I have ever heard. And so I just wanted to just undergird what you have already said by addressing, you know, the issues of fear. The ultimate goal of fear is to persecute and paralyze our souls. If our souls are paralyzed, then we become disabled from going forward toward what God has ordained for our lives. Instead, with fear, we continue to procrastinate and experience some type of lack in our lives. Also, fear distorts reality. The true reality is God intends for us all to live no lack lives. John 10:10 says, the Lord Jesus Christ said, I am come that they may have life and have it more abundantly. That is what God ordains for our lives, that our lives will be abundant and not brought to a halt sooner than he has ordained. In other words, there are some things that we can do in order to prolong our lives and live the abundant lives that God has arranged and ordained for all of us. So, Nurse Williams, I cannot tell you how touched my heart is by just hearing you present and the information that you have presented. It sounds like there's just some very simple steps, you know, dealing with exercise and our diet. I mean, that's stuff that, you know, that God has given us dominion over. What we do with our bodies and put in our mouths, and you know, how we live our lives. God has given us free will choice so that we can actually live the abundant life that he has called us to live. Now, you also mentioned stress, you know, stress being a killer. And, you know, it just, I mean, all of these things just seem to be just so simple, just straightforward, just things that we can do in order to increase our lives, decrease the risk of breast cancer in our community.
Yes, definitely. Pastor Parks, I just want to commend you because not many pastors have really, in the African American community, I'll say, we, you know, growing up in the church as a little girl, you know, you think about after church we're going to get fried chicken and greens and we're going to Big Mama's house. And so I think so all too often, I mean that's just how I was raised up in the black church, and so to see you as a pastor being an example and building a platform to educate people that God, like you said, God wants us to live an abundant and healthy life, and our bodies are a living sacrifice. And so how we treat our temples is our relationship with God as well. So when we treat our bodies any kind of way, we're not honoring his temple, we're not honoring his word, and we're not honoring him in our lives because we don't even care enough about ourselves to what we put in our bodies. So I just want to commend you. Not many pastors are doing what you are doing to educate people about their health. The black churches are filled with sick people, so many sick people, and we have and they have great faith. They believe in God. But then as soon as we leave ourselves church doors, we eating that chicken and we eating those ham hocks. And so we're killing ourselves. We're killing ourselves.
That's so interesting because, you know, I haven't always been a pastor who has, you know, eaten well or tried to eat well. And that's because I have a first lady, Lady Shelley, who sees that I have changed the way she's brought a change to my life. So, so I thank God for her because had it not been for her, I would still be making my way to Popeyes. So
awesome.
Not only that, but I'm tired of preaching funerals and going to funerals, family members and people that I know and love and adore and trust and just know that God has a great plan for. I'm just tired of that. In that, you know, there were things that could have been done, you know, so that those moments didn't have to occur when they did. So I'm just tired of that, and you know, and I feel like there is a sense of mission and there is an urgency right now in the community that we really have to address. And so I really do thank God for you. Also want to thank God for there's an organization that I'm connected to called the Sisters Network. Before I go into that, I want to make sure that your information is shared with the world. You know, there to be I don't know how the text thing works. Maybe you could tell us how that works, and if you want to give us an email or other information you want to provide. People can. I want to get this on the record because I want people to be able to get to you if they can.
Okay, definitely. So for the text, they can just pull out their mobile phone and text the word "healthy, happy life," and they text that to 22828. And what will happen is they'll get my newsletters, monthly newsletters that have different health tips that'll come to their emails, as well as events that I may be speaking at or a part of. And then I also write for Girlfriend's Health Guide magazine. And this is a national magazine that's out of Milwaukee. And so I write usually cancer-related articles. But definitely they can also look me up on Facebook under Priscilla Williams, as well as LinkedIn under Priscilla Williams. So my email address is priscillaQwilliams@att.net or priscillaQwilliams@gmail.com.
Amen. Okay, I want to make sure people get that, and if they have any additional questions, because you covered a lot of real estate in a very short amount of time, and if anyone has any questions, I certainly would not be able to answer them in that regard. I want to make sure that you are utilized as a resource in the kingdom of God, and I know that God has great things planned for you, and has put in you, imparted to you great wisdom and great insight. So thank you so much for being a part of this discussion, leading the discussion, and giving us such robust information. It was well done.
Thank you. Thank you.
Welcome. I start out by saying that I'm connected to an organization. I don't know if you know about it, Nurse Priscilla, but there's an organization called Network. Are you familiar with them?
The Sisters Network, yes. I actually have a few friends that are a part of the network, and it's here in Chicago as well.
Yeah, it's a national organization, and they have local affiliates. And since I live in Prince George's County, and since we have one of the highest mortality rates from breast cancer in the African American community, I wanted to link up with them, and so we have teamed up together to, to try to fight this good fight of faith and with action. And I've just put up a graphic here that that says, buy a book, Sisters Network, Prince George's County. I've written a book called Overcome Procrastination God's Way, and the reason why we thought it was such a good team was so that, what we've mentioned is that people are procrastinating on taking action, and as a result of that procrastination, people are dying. So, it's really not about the book or me selling books. It's about giving people information so that they can, maybe address some of those fears and take action a little bit sooner or a lot sooner and live a lot longer. So I have made the personal commitment to the Sisters Network of Prince George's County that anything that I sell in the way of a book, I'm going to give them 1/3 of my sales for the month of October. So I just wanted to make that mention. I'm not a salesperson like that, but it seems like right now it's not about what I sell, but it's about this information that can help people to live longer and healthier lives.
Yes. I'll make sure to purchase my book.
No, you won't have to. But I did want to just mention that for those who do want to purchase a book, they can get it at clarenceparks.com/don't-procrastinate. So, I just wanted to just get that on the record so that people could know where to go to get it. And to.
But I definitely want to order one. I definitely want to purchase my book, though, because I want to,
You might get some objection from me, though, because you've done such a wonderful job that I just feel compelled to share with you any resources that I have in my fingertips. But I appreciate you saying that. I hear exactly what you're saying.
Yes.
Okay, so that's it. I don't know if there are any additional questions. I know that a couple of people had signed on. I'm not sure if they're still on or not.
Okay.
But this will be, I will make this recording available to you and to anyone else who wants to receive it. As soon as this meeting is over, it will start processing, and then it will download, and I'll make sure you get your copy, and anyone else who wants to get a copy, they can just come right to your website and get it. Okay? So, Nurse Williams, you have enlightened us, and you have warmed our hearts tonight with your preparation and with your inspiration and with your ability to engage us in such a way that made the information crystal clear that there are some steps that can be taken, some action that can be taken. So thank you for letting the Lord lead you. Thank you for helping to save lives, and what you do is such a critical thing. And just, don't be weary in well-doing, because God has a great reward for you.
Thank you.
Amen.
Amen.
So, look, I am a preacher, so you get me wound up and I'll be gone. So I better stop while I'm ahead. So, again, thank you so much. And I look forward to cooperating and working with you in the future.
Yes. Thank you so much, Pastor Park. And your lovely wife.
Oh, absolutely. She said thank you. Can you hear in the background? She said thank you.
Yes,
all right. So you. God bless you, and thank you. And
thank you again. God bless you.
God bless you. Good night.
Good night.
Amen.